Question 1. A patient is 6 hours post-op after a cholecystectomy and reports severe right shoulder pain. What is the nurse's priority action? A. Administer prescribed morphine. B. Assess respiratory status. C. Apply a heating pad to the shoulder. D. Encourage ambulation. Answer: B. Assess respiratory status. Rationale: right shoulder pain after a cholecystectomy is often referred pain from diaphragmatic irritation due to residual carbon dioxide used in laparoscopic surgery. However, the nurse must first rule out respiratory complications, e.g., pneumothorax or atelectasis, as these are life-threatening. Assessing respiratory status, breath sounds, oxygen saturation is the priority. Morphine, A, may mask symptoms. A heating pad, C, is inappropriate, and ambulation, D, is secondary to ruling out complications. Question 2. A patient post-appendectomy has a fever of 101.2 degrees Fahrenheit and purulent drainage from the incision site. What should the nurse do first? A. Administer acetaminophen. B. Obtain a wound culture. C. Change the dressing. D. Notify the surgeon. Answer: B. Obtain a wound culture. Rationale: fever and purulent drainage suggest a surgical site infection, SSI. Obtaining a wound culture first identifies the causative organism and guides antibiotic therapy, which is critical for treatment. Acetaminophen, A, only treats the symptom. Changing the dressing, C, is secondary, and notifying the surgeon, D, follows after collecting the culture to avoid contaminating the sample. Question 3. A nurse is preparing a patient for a total hip replacement. Which preoperative teaching point is most important? A. Use of assistive devices post-op. B. Deep breathing exercises. C. Pain management options. D. Importance of NPO status. Answer: D. Importance of NPO status. Rationale: NPO status prevents aspiration during anesthesia, a life-threatening complication, making it the highest priority preoperative teaching. Deep breathing, B, prevents atelectasis but is postoperative. Assistive devices, A, and pain management, C, are important but not immediate safety concerns. Patient understanding of NPO reduces surgical risks. Question 4. A patient post-thyroidectomy reports tingling around the mouth and muscle spasms. What should the nurse assess first? A. Serum calcium levels. B. Oxygen saturation. C. Blood pressure. D. Thyroid hormone levels. Answer: A. Serum calcium levels. Rationale: tingling and muscle spasms post-thyroidectomy suggest hypocalcemia due to accidental parathyroid gland removal, which regulates calcium. Low calcium can lead to tetany or seizures, making it the priority assessment. Oxygen saturation, B, blood pressure, C, and thyroid levels, D, are less urgent, as they do not directly correlate with these symptoms. Question 5. A nurse is delegating tasks for a post-op patient. Which task can be delegated to an unlicensed assistive personnel, UAP? A. Assess incision site for redness. B. Administer 4 morphine. C. Assist with ambulation. D. Interpret lab results. Answer: C. Assist with ambulation. Rationale: assisting with ambulation is within the UAP scope of practice, promoting mobility and preventing complications like DVT. Assessing the incision, A, and interpreting labs, D, require nursing judgment, and 4 morphine administration, B, is restricted to licensed nurses due to safety concerns. Delegation must align with scope of practice. Question 6. A patient post-colon resection has a hemoglobin of 7.8 grams per deciliter. What is the nurse's priority action? A. Administer oxygen. B. Prepare for blood transfusion. C. Encourage oral fluids. D. Monitor vital signs. Answer: B. Prepare for blood transfusion. Rationale: a hemoglobin of 7.8 grams per deciliter indicates significant anemia, likely from postoperative bleeding, requiring a blood transfusion to restore oxygen carrying capacity. Oxygen, A. May be supportive, fluid. C. Do not address anemia. And monitoring vital signs. D. Is ongoing but not the priority intervention. Transfusion preparation is urgent to prevent hypoxia. Question 7. A patient 2 days post-op from a bowel resection reports sudden shortness of breath and chest pain. What should the nurse suspect? A. Pneumonia. B. Pulmonary embolism. C. Atelectasis. D. Myocardial infarction. Answer: B. Pulmonary embolism. Rationale: sudden shortness of breath and chest pain post-op suggest pulmonary embolism, PE, a life-threatening complication from immobility-related DVT. Pneumonia, A, typically presents with fever, atelectasis, C, with gradual onset, and myocardial infarction, D, with ECG changes. The nurse should administer oxygen, notify the provider, and prepare for anticoagulation or imaging. Question 8. A nurse is caring for a patient post-mastectomy with a Jackson-Pratt drain. The drain output is 120 milliliters of serosanguinous fluid in 8 hours. What should the nurse do? A. Strip the drain tubing. B. Notify the surgeon. C. Document the output. D. Remove the drain. Answer: C. Document the output. Rationale: serosanguinous drainage of 120 milliliters in 8 hours is expected post-mastectomy. Documenting the output monitors for trends, e.g., excessive bleeding. Stripping the drain, A, is routine but not priority. Notifying the surgeon, B, is unnecessary unless output is excessive, greater than 200 milliliters per shift. And removing the drain, D, is premature without provider orders. Question 9. A patient post-op day 1 after a craniotomy has a BP of 180/100 mmHg. What is the nurse's priority action? A. Administer antihypertensive medication. B. Elevate the head of the bed. C. Notify the neurosurgeon. D. Reassess in 15 minutes. Answer: C. Notify the neurosurgeon. Rationale: hypertension post-craniotomy can increase intracranial pressure, ICP, risking brain herniation. Notifying the neurosurgeon is the priority for immediate intervention, e.g., medication or imaging. Administering medication, A, requires an order. Elevating the bed, B, is supportive but secondary. And reassessing, D, delays critical action. Question 10. A patient post-op from a knee replacement refuses to use the continuous passive motion, CPM machine. What should the nurse do first? A. Forcefully place the leg in the CPM. B. Explore the patient's concerns. C. Notify the physical therapist. D. Document refusal and stop the CPM. Answer: B. Explore the patient concerns. Rationale: exploring concerns addresses the patient's reasons, e.g., pain, fear, promoting adherence and therapeutic communication. Forcing the CPM, A, violates autonomy. Notifying the therapist, C, is secondary. And stopping the CPM, D, without exploration may hinder recovery. Understanding barriers ensures patient-centered care. Question 11. A nurse is preparing a sterile field for a surgical dressing change. Which action maintains sterility? A. Reach over the sterile field to adjust supplies. B. Use sterile gloves to open a sterile pack. C. Place sterile items near the field's edge. D. Allow a non-sterile item to touch the field. Answer: B. Use sterile gloves to open a sterile pack. Rationale: using sterile gloves to open a pack maintains the sterile field's integrity. Reaching over, A, risks contamination. Placing items near the edge, C, violates the 1-inch border rule. And allowing non-sterile contact, D, breaks sterility. Proper technique prevents surgical site infections. Question 12. A patient post-laminectomy reports numbness in the legs. What should the nurse do first? A. Administer pain medication. B. Assess neurological status. C. Reposition the patient. D. Encourage ambulation. Answer: B. Assess neurological status. Rationale: numbness post-laminectomy may indicate nerve compression or hematoma. which could lead to paralysis. A neurological assessment, sensation, motor function, is the priority. Pain medication, A, does not address numbness. Repositioning, C, is secondary, and ambulation, D, is unsafe until the cause is identified. Question 13. A patient post-op from gastric bypass has a heart rate of 120 bpm and low urine output. What should the nurse suspect? A, hypovolemia, B, sepsis, C, pain, D, arrhythmia. Answer: A, hypovolemia. Rationale: tachycardia and low urine output post-gastric bypass suggest hypovolemia, likely from bleeding or fluid loss. Sepsis, B, typically includes fever. Pain, C, does not cause oliguria. And arrhythmia, D, requires ECG confirmation. The nurse should assess for bleeding, check labs, and prepare for fluid resuscitation. Question 14. A nurse is teaching a patient about postoperative wound care. Which statement indicates understanding? A, I'll clean the wound with alcohol daily. B, I'll keep the incision dry and covered. C, I'll remove the staples myself. D, I'll apply lotion to the incision. Answer: B, I'll keep the incision dry and covered. Rationale: keeping the incision dry and covered prevents infection and promotes healing. Alcohol, A, is too harsh. Removing staples, C, is a provider task. And lotion, D, risks contamination. Patient education ensures adherence to evidence-based wound care practices. Question 15. A patient post-op from a total knee replacement has a temperature of 100.4 degrees Fahrenheit. What should the nurse do first? A, administer antibiotics. B, encourage deep breathing. C, assess the surgical site. D, notify the provider. Answer: C, assess the surgical site. Rationale: a low-grade fever post-op may indicate a surgical site infection or atelectasis. Assessing the surgical site for redness, swelling, or drainage identifies the cause. Antibiotics, A, require a culture or order. Deep breathing, B, addresses respiratory issues. And notifying the provider, D, follows assessment. Question 16. A patient post-op day 2 after a hysterectomy reports sudden severe abdominal pain. What should the nurse assess first? A, bowel sounds. B, incision site. C, vital signs. D, pain level. Answer: C, vital signs. Rationale: sudden severe pain may indicate complications like hemorrhage or infection. Assessing vital signs, e.g., tachycardia, hypotension, identifies life-threatening issues like shock. Bowel sounds, A, and incision site, B, are secondary, and pain level, D, is already reported. Vital signs guide urgent interventions. Question 17. A nurse is monitoring a patient post-op from a bowel resection. Which lab result requires immediate action? The options are: A, white blood cell count of 12,000 per cubic millimeter. B, hemoglobin of 11 grams per deciliter. C, international normalized ratio of 3.5. D, potassium of 3.8 milliequivalents per liter. Answer: C, 3.5 Indian rupees. Rationale: an INR of 3.5 is above the therapeutic range, 2.0 to 3.0, for anticoagulation, indicating a high bleeding risk post-op. Immediate action, e.g., stopping anticoagulants, notifying the provider, is needed. WBC, A, is mildly elevated, hemoglobin, B, is low but stable, and potassium, D, is normal. Question 18. A patient post-op from a coronary artery bypass graft, CABG, has a chest tube with 300 milliliters of bright red blood in 2 hours. What should the nurse do first? A, strip the chest tube. B, notify the surgeon. C, increase 4 fluids. D, document the output. Answer: B, notify the surgeon. Rationale: excessive bright red blood, 300 milliliters in 2 hours, suggests postoperative hemorrhage, a life-threatening complication. Notifying the surgeon is the priority for intervention, e.g., re-exploration. Stripping the tube, A, may dislodge clots, increasing for fluids, C, requires an order, and documentation, D, is secondary. Question 19. A nurse is caring for a patient post-op from a TURP. Which finding indicates a complication? A. Pink-tinged urine, B. Continuous bladder irrigation, C. Blood clots in the urine, D. Burning during urination. Answer: C. Blood clots in the urine. Rationale: blood clots post-TURP indicate potential bladder obstruction or significant bleeding, requiring immediate intervention, e.g., manual irrigation. Pink-tinged urine, A, is expected. Continuous irrigation, B, is standard, and burning, D, is common due to catheter irritation. Clots signal a serious complication. Question 20. A patient post-op from a spinal fusion reports a severe headache when sitting up. What should the nurse suspect? A. Dehydration, B. CSF leak, C. Meningitis, D. Hypertension. Answer: B. CSF leak. Rationale: a positional headache post-spinal fusion suggests a cerebrospinal fluid, CSF, leak, a complication from dural puncture. Lying flat often relieves symptoms. Dehydration, A, is less specific. Meningitis, C, includes fever and nuchal rigidity, and hypertension, D, is unrelated to positional changes. The nurse should notify the provider. Question 21. A nurse is assessing a patient post-op from a femoral popliteal bypass. Which finding requires immediate action? A. Pedal pulse 2+, B. Swelling in the affected leg, C. Warm skin on the leg, D. Pain controlled with medication. Answer: B. Swelling in the affected leg. Rationale: swelling post-femoral popliteal bypass may indicate graft occlusion or DVT, both urgent complications. A pedal pulse, A, and warm skin, C, are expected, and controlled pain, D, is normal. The nurse should assess for other signs, e.g., pallor, pulselessness, and notify the provider. Question 22. A patient post-op from an open reduction internal fixation, ORIF, has a cast. Which assessment finding is most concerning? A. Itching under the cast, B. Capillary refill of 4 seconds, C. Mild swelling distal to the cast, D. Tingling relieved by elevation. Answer: B. Capillary refill of 4 seconds. Rationale: a capillary refill of 4 seconds indicates impaired circulation, suggesting compartment syndrome or cast compression, which can lead to tissue damage. Itching, A, is common, mild swelling, C, is expected, and tingling relieved by elevation, D, is less urgent. The nurse should notify the provider immediately. Question 23. A nurse is teaching a patient about anticoagulant therapy post-op from a hip replacement. Which statement indicates a need for further teaching? A. I'll avoid using aspirin, B. I'll report unusual bleeding, C. I'll take my medication in the evening, D. I'll eat more green leafy vegetables. Answer: D. I'll eat more green leafy vegetables. Rationale: green leafy vegetables are high in vitamin K, which antagonizes warfarin, reducing its anticoagulant effect and increasing clot risk. Avoiding aspirin, A, and reporting bleeding, B, are correct, and evening dosing, C, is acceptable. Further teaching ensures dietary consistency for therapeutic INR. Question 24. A patient post-op from a colectomy has absent bowel sounds. What should the nurse do? A. Encourage early ambulation, B. Administer a laxative, C. Notify the surgeon, D. Stop oral intake. Answer: A. Encourage early ambulation. Rationale: absent bowel sounds post-colectomy indicate ileus, a common temporary complication. Ambulation stimulates peristalsis. Laxatives, B, are inappropriate without provider orders. Notifying the surgeon, C, is premature unless symptoms worsen, and stopping oral intake, D, is unnecessary unless NPO is ordered. Question 25. A nurse is caring for a patient post-op from a craniotomy. Which position is most appropriate? A. Flat with head turned. B. Head of bed at 30 degrees. C. Trendelenburg position. D. Side lying with knees flexed. Answer: B. Head of bed at 30 degrees. Rationale: elevating the head of the bed to 30 degrees post-craniotomy reduces intracranial pressure, ICP, while promoting venous drainage. Flat position, A, increases ICP. Trendelenburg, C, is contraindicated, and side-lying, D, is less effective. Proper positioning prevents complications, like brain herniation.